Hello, I'm a Dr. Pyle. It is my pleasure to nominate Dr. Kansara since I admire that he has emerged as a true COVID 19 hero. Dr. Tikal Kansara is a resident medical doctor at Metropolitan Hospital, that is a city hospital situated in the heart of the New York City. And when the COVID 19 hits the New York City, he was actually due for the vacation in the month of April. But when he realized that his other colleagues were getting infected with the COVID, there were shortage of doctors in the New York, so he voluntarily canceled his vacation. And he was treating the severe COVID 19 infectious patient in the critical ICU care. Dr. Kansara is experienced in pandemic. His last fight was treating the patient in a swine flu pandemics. So when the coronavirus was new and there were a treatment was debated, at that time he was giving a bold, complex treatment to the ICU patient that were severely infected with using his previous swine flu pandemic experience, and he was able to save the life of so many patients and reduce the mortality to a great extent. Not only this, while I have seen Dr. Kansara treating the patient 12 to 14 hours a day, almost 5 or 6 days in a week, without having a drink of water or food, because that time was critical. And I believe when he opens his mask just to have water, and he might get infected. So yeah, he spent his those days just treating the patient, nothing else. And I think in the other time also, when he realized that there was not a proper guidelines for the treatment, so he started researching on treatment aspect for the coronavirus, and after successful attempt he was able to publish an article in the very good index journal. And I can proudly say that the treatment on which he was working on, that was given to Mr. President when he was infected with the coronavirus. And I think he has lifted the spirit of other his colleagues also, and other doctors even in the US and also in the other countries, especially in India, where he was sharing his experience. And because he has an advantage of treating the patient in the US, so I acknowledge that he deserves a true recognition. And I think he's a great COVID hero warrior.